so much, everyone. We're so glad that you could join us this morning for August's edition of Health Bytes. And we are so pleased to welcome our speaker this month, Robyn Kovacs. With a passion for helping others to use food for improved health and quality of life, Robyn has spent more than 20 years translating nutrition science into actionable steps for patients and clients across a variety of settings. As a registered dietitian nutritionist, she has provided medical nutrition therapy for numerous conditions with a focus on renal disease, diabetes, and weight management. In her current role as assistant professor of clinical nutrition at UNT Health Fort Worth, she is profoundly honored to be a part of the growing nutrition profession by training and mentoring future registered dietitian nutritionists. In today's Health Bites, our speaker will give a presentation on medical nutrition therapy and clinical practice, enhancing patient outcomes. Thank you, Robyn, so much for being our guest speaker this morning. We're so grateful to have you with us, and I'm going to turn everything over to you.
Okay, thank you so much. I really appreciate being invited to speak on this topic. It's something I'm definitely very passionate about, and thank you for that introduction. I know we're a little bit late, so let's just get right into it. So medical nutrition therapy and clinical practice, enhancing patient outcomes. I'm going to start just by going over our objectives for today. We're going to define what medical nutrition therapy is, describe the role of the registered dietitian nutritionist in providing medical nutrition therapy, identify key conditions or disease states that can benefit from MNT interventions, discuss the value of MNT or medical nutrition therapy as part of an interdisciplinary team approach to support whole person care. So let's get started. It's quite a big topic, so I'm going to try my best to condense this into 40 or so minutes. If we still have that much time, we may have a little bit less. So I did have a poll here I wanted to start with. However, with my internet being a little bit unreliable, I'm afraid to exit out of this to kind of see what the responses will be. Feel free to scan the QR code if you want to give this a shot, and it'll give you the answer once you submit if you're interested in trying this out. But I just had a kind of an opening question, just a true or false. And it's medical nutrition therapy is synonymous with nutrition education, which is providing information, and nutrition counseling, which is providing guidance for behavior change. So since I'm not going to be able to see your answers right now, and I can go back and look at them a little later because I would be interested to know how the audience would answer that question. But if you've had a chance to scan that QR code and answer it, you can see that technically the answer is false. And I know I may have been a little bit of a tricky question, but it's technically false because it's really an incomplete statement. It really oversimplifies what medical nutrition therapy actually is. So while both education and counseling are examples of services that registered dietitians often provide and may be part of medical nutrition therapy, MNT's more thorough treatment plan that is specifically provided by a dietitian. And I put this in bold because this is really an important defining aspect of medical nutrition therapy, because just educating or providing nutrition information or counseling, these are things that may actually be sometimes provided by other health professionals. So medical nutrition therapy is definitely more than just dietary advice. It's a medically supervised nutrition plan that's used to treat or manage one or more health conditions. So let's look at some ways to define it a little bit more clearly in some different ways. So you can see the first line there. It is a thorough nutrition-based treatment approach provided by registered dietitians to enhance patient health outcomes through evidence-based interventions. And the Centers for Medicare and Medicaid Services definition of MNT is that it's nutritional diagnostic therapy and counseling services for the purpose of disease management, which are furnished by a registered dietitian pursuant to a referral by a physician. And lastly, according to the Academy of Nutrition and Dietetics Evidence Analysis Library, MNT results in the prevention, delay, or management of diseases and or conditions. So you can see it's definitely more specific than just dietary advice or just nutrition education or counseling. And the Academy of Nutrition and Dietetics has really made their position very clear that medical nutrition therapy and other complex nutrition services should only be provided by qualified individuals with the specialized education and training of registered dietitian nutritionists. So let's look at who are registered dietitian nutritionists. So the term registered dietitian nutritionist is really synonymous with registered dietitian. Sometimes they just go by dietitians. These are nationally protected titles. So they are credentialed nutrition and health experts, and the requirements to obtain that title are very strict. They must have complete an accredited dietetics program with an extensive supervised practice experience of a minimum of 1,000 hours. They must hold a graduate degree of master's or PhD. Also must pass a national credentialing exam for registered dietitians, as well as they must continue to complete ongoing continuing education throughout the course of their career to ensure competency in the field of nutrition. So before we get into the specifics of how medical nutrition therapy is utilized, I thought it would first be helpful to look at the strength of the relationship between nutrition and health and disease, and just why nutrition matters. So according to the CDC data, 60% of US adults are living with at least one chronic disease. 40% actually have two or more. And approximately 80% of those diseases are considered to be preventable through dietary and lifestyle modifications. And this statement I have here at the bottom of the slide, this was taken from a joint report by the World Health Organization and the Food and Agriculture Organization. It reads, nutrition is a major modifiable determinant of chronic disease, with scientific evidence increasingly supporting the view that alterations in diet have strong effects, both positive and negative, on health throughout life. And I really like this because it's a reminder that nutrition is a modifiable determinant of disease. It's something that is within our control, that we have the ability to modify and to change. And it's something that can really either support health or support the development of disease. And now a person's nutrition not only influences the development of diseases later in life, but it also has a strong impact on current health, disease severity, and complications of disease. So medical nutrition therapy can be a highly effective supportive therapy for people with chronic illnesses and complex health conditions. So let's take a brief look at how dietitians provide medical nutrition therapy. Medical nutrition therapy is an evidence-based application of what's known as the nutrition care process. And this is a systematic approach that dietitians use to provide high-quality nutrition care. And it consists of distinct interrelated steps. So I attempted to kind of summarize the nutrition care process on this slide. There is a lot to it, and it's really hard to put it all into one slide. So I've just kind of briefly hit the highlights here. But you can see there's four main areas or steps. Consists of assessment, then diagnosis, then intervention, and then the last one is monitoring and evaluation. So in nutrition assessment, comprehensive data is gathered, including a food nutrition related history, which I've noted here as being extensive because it's much more than just taking a diet record or finding out what someone usually eats. And dietitians use very non-judgmental. They're trained to ask questions in open-ended manners, non-judgmental manners, to fully and accurately assess the usual intake of a person, including energy intake, fluid intake, macronutrient, micronutrient intake, composition of the diet. So that means the amounts and balance of protein, carbohydrate, fat, vitamins, and minerals. And then we also look at that information and compare what someone's taking in to their estimated needs. And these estimated needs are highly individualized, different for everyone. They have to be accounted for their age, their gender, their activity level, their disease state, and any other conditions that may impact their nutrient needs. In a food nutrition related history, we're also assessing for someone's diet history, which includes any current diets, previous diets. Sometimes those may be prescribed by a doctor or even self-selected oftentimes. We'll look at past dieting attempts, if maybe they might have a need for food modifications, if they have food allergies or intolerances. In addition, we also assess for food nutrition related knowledge to identify any barriers to change or their readiness to make nutrition changes. And then also just someone's emotions about food. I mean, everyone has a relationship with food, and this is something that not everyone recognizes at first. But when we start to kind of delve in and gather some of this assessment data, some of that comes to light. Other important assessment areas include assessing for disordered eating or restrictive eating behaviors, also food access and availability, food security level. So you can see it truly is very extensive food nutrition related history. It's not just simply tell me what you ate yesterday. There's a lot more to it that goes into really taking that full assessment of food nutrition related history. And then that's just the first part of nutrition assessment. You can see next on the list is we're going to take account of any medications that someone might be taking, both prescription and over the counter, as well as any supplements that someone might be taking. We'll use this information to assess for side effects or potential drug nutrient interactions. Next on the list is anthropometrics, which just means body measurements. So we're looking at someone's height, weight, body mass, body composition, which is just referring to what the body is composed of in terms of body fat and muscle mass and things like that. And then we're also looking at changes in weight and growth patterns over time. Next on the list, biochemical data or lab values. We're also looking at the results of any medical tests or procedures. And then finally, we're assessing for physical signs and symptoms that reflect nutrition status by completing what's known as a nutrition-focused physical exam, or NFPE. And a nutrition-focused physical exam is something that a dietitian will do that really allows for an assessment, a head-to-toe assessment of things that can implied about their nutrition status. We're looking for fat and muscle stores, presence of fluid accumulation, looking at someone's hair, eyes, lips, teeth, gums, their skin, their nails. All these things can alert to possible signs of nutrition-related causes or potential nutrient deficiencies or excesses. So the assessment process is really the biggest piece of this, the most time consuming. Dietitians are really good at taking time to pull out all this information because an adequate assessment is needed in order to really define what the problem is and go from there. So that really takes us to the next step, which is diagnosis. So identifying what the nutrition problem is. And this is different from a medical diagnosis. I'm talking about a nutrition diagnosis here. So this is really what is the nutrition-related problem that our intervention can resolve or improve. So once we've identified that, the next step is obviously to plan a goal and to implement an intervention of evidence-based condition-specific strategies that are tailored to the client needs. This can include instruction or training to help a client manage disease or side effects, modify the food or nutrition intake, problem solving to support sustainable changes, or sometimes it's coordination of care, which refers to collaborating with or referring to other health professionals when that's indicated. And then finally, the fourth step over on the lower left corner, monitoring and evaluation, which is the process of just continued support over time. So following up on someone's progress, outcomes, and then adjusting any goals or strategies as needed. So you can see it's quite a complex process, and I know that's a lot of information on one slide. So let's go ahead and move on to who can benefit from medical nutrition therapy. And really the easy answer, the one I always like to say, is really anyone, because nutrition impacts everyone regardless of health status. However, medical nutrition therapy is particularly effective at managing chronic conditions. And I've listed some of them here, including diabetes, kidney disease, obesity, hypertension, cancer, gastrointestinal conditions, such as celiac disease, IBS, inflammatory bowel diseases, eating disorders. Also, conditions commonly seen in special populations, gestational, pediatrics, where we may see things like feeding problems, growth problems, older adults. And in the older adult population, this is when we start to see more and more diseases kind of accumulate on top of each other. So usually more than one is present at a time. Also, we have impact in changes in appetite and muscle loss and difficulty eating and swallowing could come into play and all that stuff. So a lot of needs can arise with that special population. And then also there's acute conditions that require medical nutrition therapy. So for example, recovering from trauma, surgery, burns, and wounds. So this is by no means an exhaustive list. It's just a sampling of some examples that of the many different conditions and populations that can benefit from medical nutrition therapy. So we don't have time to go through each and every one of these, obviously. So today I will be just focusing on those top three: diabetes, kidney disease, and obesity. So first, to start with diabetes, medical nutrition therapy is a cornerstone of comprehensive diabetes care, recommended at diagnosis and continued ongoing. And while the focus of diet therapy for diabetes may focus on or may concentrate on carbohydrate intake, there is not one standard diabetic diet. And this is something that always gets me. I hear people talk about, oh, diabetic diet, and there's not one standard diet that can be defined like that. Medical nutrition therapy should really be personalized to support the needs of each individual, and with consideration of the specific type of diabetes, the culture, the likes, the dislikes, the preferences, all that stuff has to come into play, as well as what medications they're on. So for individuals with type 1, dietitians are able to help them understand how food choices, activity levels, insulin dosages affect their blood glucose. So individualized meal and lifestyle planning supports blood glucose regulation. So this includes training on carbohydrate intake to insulin ratio, also the treatment and prevention of hypoglycemia or low blood sugar, which can occur with the use of insulin. For individuals with type 2 diabetes, diet and lifestyle education to support not only controlled blood glucose levels, but also lipid profiles, blood pressure, and healthy weight is a priority. So for both type 2 as well as type 1, glycemic control helps to reduce the risk of long-term complications, which include kidney, eye, and nerve damage. So the better control we can help assist people to obtain, the less likely those complications are. And also the increased use of continuous glucose monitors, those have been great. They've really offered a way for dietitians and other health professionals to kind of better monitor and track blood glucose trends. Excuse me. And dietitians can use that information to better identify patterns and guide food and medication adjustments. And then lastly on this slide, I have gestational diabetes. Medical nutrition therapy supports the management of blood glucose and controlled appropriate weight gain to support a healthy pregnancy and reduce the risk of complications for mom and baby. And additionally, moms with gestational diabetes do have an increased risk of developing type 2 diabetes later in life. So medical nutrition therapy is beneficial in this population to encourage and kind of set the groundwork for some of those lifestyle habits that can help to prevent long-term risk of type 2 diabetes from developing. Also benefit to people with pre-diabetes. In the condition of pre-diabetes, blood glucose levels aren't at high enough levels to qualify as diabetes, but it is a warning sign that indicates someone is heading in the direction of developing type 2 diabetes. So the reason that this is so important is because the most effective strategy to impact health that we have is really the prevention of disease rather than waiting and trying to treat it after it occurs. So this is another really profound way that medical nutrition therapy can make a positive impact is by supporting healthy diet and lifestyle changes that can support healthy weight loss, that improves insulin resistance and normalizes blood glucose levels to help prevent diabetes from developing. And as noted on this slide, you can see the position statement of the Academy of Nutrition and Dietetics that medical nutrition therapy provided by RDNs is successful and essential to preventing progression of prediabetes and obesity to type 2 diabetes. And just in case you're looking for some more hard facts on the benefits of MNT for diabetes, as you can see from this slide, patients who work with the dietitian to manage their type 2 diabetes can experience a 2% decrease in hemoglobin A1C levels. And this is the lab that or the blood test that reflects someone's average blood sugar over the span of about 3 months' time. So it's a good indicator to kind of give us a history of how glycemic control is. And so we can really expect that 2% decrease. And for every 1 point decrease, this correlates with a 40% decrease in the risk of complications. So this is quite a notable benefit. Okay, moving right along. So next up we have kidney disease. So kidneys function to filter waste products from the blood, balance fluids, regulate mineral levels. So when the kidney function becomes impaired, this creates many nutritional concerns. So medical nutrition therapy is an effective strategy to prevent or delay disease progression. And there are various stages of CKD or chronic kidney disease with nutritional needs that vary depending on each stage and each individual case. So nutrition therapy must be highly individualized. Individuals can benefit from education on a diet balanced in nutrients for kidney health and also to aid in the delay or prevention of the progression of their disease. And it really does take the expertise of a trained dietitian who know those evidence-based guidelines for that diet recommendations for each condition and situation. So in general, medical nutrition therapy, diet modifications for kidney disease focuses on protein intake, the type and quantity, as well as phosphorus, potassium, and sodium, which again, all are very individualized and determined using evidence-based practice guidelines. Studies have found a positive association between dietary interventions, particularly seen with plant-based diets and improvements in eGFR, which is estimated glomerular filtration rate. And this is a measurement of how well the kidneys are functioning. So that is a direct kind of reflection of the benefit that MNT can have on kidney function. Now, in situations where chronic kidney disease progresses to renal failure or end-stage renal disease, the treatment options include either renal transplant or dialysis. And individuals with end-stage renal disease who are on dialysis do have significant nutritional challenges that do require medical nutrition therapy by a registered dietitian. And the reason why they have those their increased risk for a lot of nutritional challenges is that dialysis results in nutrient losses, as well as a lot of times causes decreased appetite. Together, we're adding that on the top of the fact that they already have the need for a restricted diet. So all of these things can lead to poor nutrition status. And also, unfortunately, kidney disease is also often complicated by the presence of other comorbidities along with it, such as diabetes or high blood pressure. So that just adds another layer of complexity to medical nutrition therapy. So dietitians must guide patients on dietary modifications needed for oftentimes more than one condition at the same time. So all this considered, though, dietary counseling and other nutritional interventions by dietitians have been shown to improve nutritional intake, outcomes, and quality of life. And I do have all my references at the end if you want to open up some of these. All right, the final disease state we'll be talking about today is obesity. So obesity is a complex chronic disease, and it does increase the risk of many other diseases and conditions. As of 2023, more than 1 in 5 US adults in all states and territories had obesity. Now, this obesity prevalence map is one you've likely seen before, but I wanted to include it here today because it is a good reflection of where things stand as far as the overall rates of obesity. And you can just kind of visually see that, in the reflection of the predominantly orange and red colors of the states, that most states in the US have an obesity rate of 30% or higher. And actually, if we look at it just in totality, as of 2023, the overall prevalence of obesity among US adults 20 years and over was actually 40.3%. So quite substantial. And this is not just an issue of appearance or vanity. It's a health issue. So this slide illustrates just some of the medical complications associated with obesity. You can see from the visual here, obesity increases the risk for pulmonary disease, such as obstructive sleep apnea, stroke, heart attack, hypertension, steatohepatitis or fatty liver disease, diabetes. Certain cancers such as breast, colon, and prostate are higher or increased with obesity. Infertility issues, polycystic ovary syndrome, osteoarthritis, gout. So these are just to name a few. There's really no doubt that obesity negatively affects health in many ways. So RDNs work with patients or clients with overweight or obesity to develop interventions that facilitate improvements in dietary intake and other health behaviors which can improve outcomes. And it's the position of the Academy of Nutrition and Dietetics that MNT behavioral interventions for adults and pediatrics with obesity require the expertise from dietitians, which no other healthcare provider can provide. I know I might sound like a broken record here. The position statement also goes on to provide further explanation for the expertise of dietitians, stating that dietitians providing MNT recognize the complex contributors to overweight and obesity, and thus individualize interventions based on a shared decision-making process and deliver interventions in an inclusive, compassionate, and client-centered manner. And I think this does a wonderful job summarizing how RDNs approach medical nutrition therapy for obesity, fully recognizing that it's a very complex and multifactorial disease with a number of contributors, and interventions really must be individualized. Again, there really never is a one-size-fits-all approach when it comes to nutrition therapy. It must be personalized and delivered in an inclusive, compassionate manner in order to be effective. So the improved outcomes that patients see who work with a dietitian to lose weight are decreased BMI or body mass index, decreased waist circumference, and a correlated average of 5% weight reduction. Now, that 5% may raise a few eyebrows at what seems like a small amount of weight loss. So let's talk about this just a little bit more. 5% from baseline is generally what's accepted as being clinically meaningful weight loss. And obesity guidelines do recommend a weight loss of 5 to 10% as the goal for medically supervised weight loss using diet and lifestyle therapy. So the reason why a weight loss of 5 to 10% is clinically meaningful, we can see on this slide, is because with just that weight loss of 5 to 10%, we see improvements in things like glucose control, triglyceride reduction, HDL increase. This is that high density lipoprotein. This is the good cholesterol. So when that is increased, that's a benefit. That's a good thing. Improved mobility, decreased depression, increased quality of life scores. So, you can see that there's quite substantial health benefits in just a 5 to 10% weight loss. In fact, the top two, glucose control and triglyceride reduction, as noted on this slide, you can see that improvements are seen in those two areas with just a 2.5% loss of body weight from baseline. So that really does really illustrate the fact that, that clinically significant weight loss really does help improve outcomes. Now, there is a greater magnitude of improvement seen with greater amounts of weight loss beyond 5 to 10%, but it does illustrate the important point, which is that improvements of health can be seen with even small amounts of weight loss. And normalization of weight does not need to be achieved to see health outcomes. So it's important that the primary focus be on the health outcomes and not simply, the number on the scale. In my experience, people often stay, fixated on the number that they want to see or that they do see on the scale, and they don't consider the improved health outcomes as a marker of success. So dietitians can help patients and clients to measure outcomes using other indicators such as lab values. We can look at lipid levels and blood pressure and triglycerides and things like that, as well as body composition measurements or functional status, rather than just simply looking at the weight on the scale. So as I noted just a second ago, greater amounts of weight loss are associated with greater improvements. We can kind of see this stepwise little figure here that, as we just mentioned earlier, only a 2 to 5% loss of body weight is already reflecting benefits in blood glucose and triglycerides. We have improvements in blood pressure, HDL cholesterol, osteoarthritis, polycystic ovary syndrome, quality of life. All of that's seen with weight loss of just 5 to 10%. However, studies do suggest that greater amounts of weight loss above 10% are required to see improvements in certain conditions, especially for those where we're looking for decreased inflammation or inflammatory markers. So examples of these things would be like obstructive sleep apnea or steatohepatitis, which is like fatty liver. So a significant weight loss may need to be seen before we see improvements in some of those things. In addition to that, the threshold for reduction in cardiovascular events and all-cause mortality isn't noted until there's a weight loss of greater than 15%, as well as the remission of type 2 diabetes. So some important points regarding obesity and lifestyle modification. And when I say lifestyle modification, I'm referring to a combination of diet, physical activity, and behavior modification. But we can see average weight loss achieved using comprehensive lifestyle modification is 5 to 10% weight loss from baseline. And it is true, a fact that really cannot be ignored is that sustaining weight loss long-term definitely has challenges. It is very difficult. The challenges that are seen include high variable responses and success rates to weight loss. Even two people doing exactly the same thing may have very different responses or amounts of weight loss. In addition to that, weight loss typically plateaus around 6 months or so. And also, most individuals who do lose weight do regain it. And so this is something that I know many people struggle with. I've seen this in practice a lot. Clients report being able to lose weight successfully, but where they have the biggest struggle is in keeping the weight off. So that's definitely a challenge for weight management. Another challenge is that many patients or clients have preferences for higher amounts of weight loss than the amount that we typically can achieve by diet and activity treatment options alone. So that 5 to 10%, most people actually ideally want more than that. And so these factors are important to understand because they can cause individuals to become disappointed and question, you know, their motivation and how to, the motivation to kind of keep up the work and the effort. So speaking of the amount of weight loss preferred by individuals, I really found this study very interesting. So I wanted to include this figure. It shows the average amount of weight loss that individuals in what was called the observed study reported wanting to lose. So these were all individuals among people with obesity. There were over 1,000 participants in this study. And it shows the participants reported a weight loss or desiring a weight loss, or I'm sorry, a weight loss. Let me get this straight. Sorry. A weight loss of an average of just below 5% was what they described as being disappointing. And a weight loss of 10.3%, that was the average threshold as being acceptable. So this really suggests that the majority view that 5 to 10% weight loss range that we generally see with diet and lifestyle modifications as being unacceptable. So you can see here also that respondents were happy with an average weight loss of 14.6%. And the average goal weight loss was actually 16.7%. And then finally, dream weight loss is 23.5%. So again, that suggests that 5 to 10% loss that we typically can achieve through diet and lifestyle modifications are really not in line with what most people would actually like to lose. So the reason why I bring this up, the reason why it's important to recognize is because the ability to set and achieve a reasonable goal helps to support satisfaction and the continuation of treatment. So if someone doesn't feel the efforts they're putting forth are giving them the results they're looking for, it's not hard to imagine why they might, choose to stop the treatment. But interestingly, the preferred amount of weight loss that was found in this study, so looking at kind of like the happy and goal weight ranges there, is actually what the amount of weight loss that's being seen in individuals who are using the newer generation weight loss medications that are now on the market. So that leads us right into our next slide. So I thought we'd discuss a little bit about those weight loss medications. And also we'll look at kind of how nutrition interacts with that too. So I'm using the term weight loss medications here, but these medications also are sometimes referred to as anti-obesity medications, incretin-based medications, or GLP-1s. And GLP-1 stands for glucagon-like peptide 1 receptor agonists. And these are medications that mimic the GLP-1 hormone that is naturally produced by the body and is released from cells of the small and large intestine in response to food intake. So this hormone binds to GLP-1 receptors that are found in the GI tract, the pancreas, the liver, the heart, the brain. They're found all over. And whenever they meet those receptors, they produce effects. And we'll talk about that in a minute. But these medications offer a therapeutic option for not only significant weight reduction, but also additional benefits, including blood sugar regulation and cardiovascular health. So this illustration shows the action of those GLP-1 hormones on various organs, as I just kind of described previously or mentioned previously. And when we look at this visual, we can kind of see that you can see my pointer here. So weight loss from these really results from reduced energy intake caused by decreased gastric emptying. So this enhances a feeling of fullness, decreased movement of nutrients and food through the GI tract, as well as increasing satiety signals. So over in the brain, we can see this causes an increased level of satiety or a feeling of fullness. So the combined actions all translate into reduction of energy intake or reduction of food intake. So these medications effectively alter what's going on internally, the internal environment that decreases hunger, decreases food preoccupation, cravings, and increases satiety. Now, benefits beyond weight loss, we can also kind of note from this figure. Effects in the pancreas is that it increases insulin synthesis and secretion, helping to lower blood glucose, also decreasing glucose production by the liver. So all these things are very beneficial for diabetes and blood sugar regulation. In the heart, we see cardiovascular protective effects, lowering of blood lipids, blood pressure improvements as well. In the liver, we also see liver fat content go down, which is beneficial for steatohepatitis. So a lot of those, additional benefits that we're also seeing with these medications can kind of be illustrated using this. So these medications are really fascinating. They're really shifting the landscape of obesity treatment because they are so effective at controlling appetite and reducing quantity of intake. They are highly effective at weight loss, and they're really helping people to achieve those higher levels of weight loss. Now, because they are so effective at producing weight loss, the focus of nutritional and lifestyle interventions don't need to revolve around the goal of helping people lose additional weight, but rather the focus is on the quality of someone's diet, making sure they're getting all the nutrients that they need in the right amounts, the right quantities, the right quality. We're trying to maintain appropriate body composition and lean muscle mass and physical function. So just because someone's on a weight loss medication does not mean that nutrition no longer is important. It's actually couldn't be further from the truth. These medications are not without side effects and nutritional considerations. So dietitians are really positioned to assist patients with managing GI side effects, which can be seen with some of these medications. Also, we can address nutritional deficiencies that can result because we can see this a lot of times when people start to eat less, calories are reduced. If they're not getting a good quality of what they are eating, then we can start to see deficiencies occur. Also, muscle and bone loss can be seen related to significant amounts of weight loss. And dietitians can also help to screen for malnutrition to make sure that we're catching that and that that's not going unchecked. The goal is not to lose as much weight as possible at any rate or at any cost. We want to be sure the weight loss is safe and measured. So that's a way that dietitians can really assist this process. So this slide it was taken from an article that I've referenced down below, a 2025 article in the American Journal of Clinical Nutrition. It was really great because it really kind of summarized some of the things that dietitians can do, their nutritional priorities. Again, the goal is not to help them lose additional weight or to restrict what they're eating, because that's kind of naturally already happening, but it's again helping them manage any side effects they might be dealing with, making sure they're getting the right diet quality, nutritious measures, nutritious lifestyles, preserving muscle and bone mass, making sure they're getting adequate protein intake, and resistance or strength training activities are really great for lean muscle mass, preventing nutrient deficiencies that might occur. So you can see there's a lot of considerations for dietitians to discuss with patients on these medications. Okay. Now, so that kind of hopefully kind of summarized a lot of what we can do in those three areas. That only really scratches the surface though. So for time, that's kind of all we have for that. I did want to also mention though, dietitians are an important member of the healthcare team. An important aspect of nutrition intervention is really identifying when or if coordination of care to other disciplines is indicated. So, the provision of whole person care, that's really the goal for all really all team, all healthcare professions. We really want a team-based approach where where each discipline can bring their individual expertise. So through a nutrition assessment, registered dietitians are able to identify areas where other disciplines can contribute to patient care. So interdisciplinary collaboration helps to ensure all aspects of the patient needs are identified and addressed. So I just wanted to kind of give some examples of who, dietitians often collaborate with other members of the healthcare team. We've got nurses and physicians for planning, coordination, and implementation of care. We work with speech language pathologists for individuals where we see swallowing difficulties, occupational and physical therapists for individuals who have reduced strength or difficulties with activities of daily living and function, maybe difficulty shopping, cooking, preparing food, things like that. Social workers for individuals who need financial or social support. We also work with pharmacists for help with adjusting management of medications. And so really that coordination of care, that interdisciplinary collaboration is really so important. And that just only helps to enhance the care and for the best interest of the patient or client. And I also wanted to mention that health and wellness professionals who are working in the field, who may not be dietitians, who are seeing clients, they can definitely complement medical nutrition therapy by recognizing when referrals to a dietitian are indicated. So that's really where, considering that when medical nutrition therapy is needed for those management of diseases and conditions. All right, some challenges and innovations to medical nutrition therapy, just real briefly. Certain barriers to MNT are access limitations, geographic disparities, awareness gaps. Some, patients or healthcare professionals aren't aware of the value of MNT or how we can provide medical nutrition therapy. There are some reimbursement issues. There's inconsistent coverage across insurance providers. There's also Medicare constraints because Medicare only covers medical nutrition therapy for conditions including diabetes, chronic kidney disease without dialysis, because when patients are in dialysis, they will see the dietitian at their dialysis facility. And then also post-renal transplant for up to 36 months. But promising advances for MNT, we do have access to telehealth now. So telehealth platforms really have expanded access to underserved populations or for people who are homebound or, may not have had access to MNT. Also, more and more digital tools are available for monitoring and feedback. There's also a Medical Nutrition Therapy Act, which is currently in Congress. It has been for a while. It's been stalled. But if this passed, this would increase medical nutrition therapy Medicare coverage to more diseases and conditions, including things like obesity and cardiovascular disease, eating disorders, GI conditions, cancer. So many of the things that can really be impacted beneficially by medical nutrition therapy would be covered if this were passed. This act would also potentially expand referrals beyond just physicians. So it would allow nurse practitioners or physician assistants to make referrals. So this would do a lot of good for a lot of people. And if you're interested in learning more about that or, looking at legislation and talking to your legislators, there is information on the American Academy of Nutrition and Dietetics website at eatright.org. And I've also listed it here at the bottom of this page because this is also where people can go to find a link for Find a Nutrition Expert. So if you're ever, wanting to see kind of where's a dietitian that I can talk to, that is a link that's available for people who are interested in looking at that. So as our time's wrapping up today, I hope I've been able to show you how medical nutrition therapy, has the power to improve health and quality of life for so many people. Because nutrition care really is an integral part of health and can also help to prevent, treat, and manage many diseases and conditions. So I've got my references here. And then obviously because I am a dietitian, I could not resist putting my brightly colored fruit and vegetable slide here for any questions. Thank you very much.
Thank you so much, Robyn. We have quite a few questions here in the chat, in the Q&A. So I can go ahead and field those for you. And some people are having to take off, but that's okay. We've shared your slides, and we also um, we've dropped the link in the evaluation for the evaluation in the chat. But I'm going to go ahead and just get started with these. So there's a question that kind of addresses some of the things that are going on in the United States. So we recognize there are quite a few food deserts within a lot of communities throughout the United States, and that oftentimes our diets are heavy in sugar and sodium, and we don't have a lot of options to have fruits and vegetables that are added daily. So the question really is, do you have any thoughts about why this is such a problem in our country? And, there's been a lot of talk that this new administration is addressing some of the Make America Healthy Again by removing some of the food dyes in our diet. So just your thoughts briefly about that.
Yes, that could be a whole nother presentation in and of itself. That is definitely something that many dietitians in the field, especially community dietitians, work with more so than I do on the clinical side and the medical nutrition therapy side of things. But it's definitely something that is important to address with everyone we meet. And just like I was talking about with nutrition assessment, we are trying to ascertain food availability, food access, and we try to assist individuals with, okay, if they don't have access to those things, how can we come together with, for example, social workers or case managers or someone that can help provide them other resources that might help. Also, we try to explore ways to work with individuals to say, not everything has to be fresh fruit and vegetable. Frozen fruits and vegetables are oftentimes, or canned, are oftentimes more, although they can be higher in sodium, they're not a completely bad choice. They can be more financially affordable. They hold longer, they don't spoil as rapidly. So we can kind of discuss some other options for people to help fortify the nutrients in their diet and also kind of work within budget. But yeah, that is definitely something that dietitians are active in, many are active in legislation and trying to advocate for more access and things like that. Unfortunately, I don't have an easy answer for that. I wish I did. That is definitely a problem. Hopefully we can make some sort of progress with that. I know a lot of people are working on that.
Great. Thanks for that good answer. So for diabetes, are you seeing a trend of primary care providers referring to MNT only versus DPP and DSMES, which I'm not sure about some of those acronyms, but if yes, do you have any talking points when to consider DPP or DSMES over MNT? So that question's in the Q&A if you want to look at it.
I think I'm still sharing my screen too. Is that okay, or should I stop sharing?
That's fine, or it's up to you. Yeah.
Medical nutrition therapy is the gold standard in my opinion. That's dietitians are ideally suited and qualified to really give the best nutrition care for patients with diabetes. So primary care providers, I will say some are aware of the benefits of referring their patients to registered dietitian nutritionists. Others maybe not so much. So that's why I do love speaking on this topic, because if you have a doctor or a primary care physician that maybe isn't so aware, it's important to advocate for yourself, for your family members, being aware, knowing that these dietitians are the best resources, that ask for a referral. That's something that we can all do. So see what your insurance will provide if you don't have Medicare and things like that. So I always say advocate for yourself. And I think definitely people with diabetes need that medical nutrition therapy by a registered dietitian.
Thank you. So here's another question. So based on the chart of the happy goal, etc., can nutrition treatment reach those goals, but does it take longer? And can it be done in stages? For example, 5 to 10% loss at a time, and maybe establishing a new baseline each time.
So not to say that cannot be done, because it absolutely can. It just isn't the standard. Let me say that. So what we typically see as achievable weight loss amounts that can be sustained over time, although it is, again, as I mentioned, hard to sustain, there are challenges with that, is really that 5 to 10% with diet and lifestyle. So that's why I did kind of go through that, because we have to kind of understand the goal, right? We have to manage our expectations, and that really is what the amount of weight loss that we see with most diet and lifestyle interventions. So when goal is higher than that, that's why now we have the option to kind of think about, okay, what other tools do we have in our tool bag that can help patients or clients be successful at attaining those higher levels of weight loss. But keep in mind, those 5 to 10%, that does a lot of benefit for people. So as I mentioned there, it's not to say that isn't worth it, right? That has a lot of health benefits, but there's not a whole lot of people that are successful with losing more than that through diet and lifestyle modification alone. Just because, again, it's hard to sustain that weight loss. As I mentioned, there's a lot of challenges. Weight loss tends to plateau over time, and there's a lot of weight regain. That's just typically what we see. So that's why it's just, not to say it's impossible. It's just not the typical, I guess I'll say.
Okay, thanks. So there's 2 more questions, and then we're going to wrap this up. So to get a dietitian consultation for obesity, would you recommend starting with one's personal physician, or are there specialized clinics or programs for this? There are definitely clinics that employ dietitians and things like that, but most of the time it does require, if you're looking for insurance coverage, you do most of the time need to start with your primary care provider just to initiate that referral. So you could definitely start there, and that way you can start with the referral, kind of see what your insurance will cover and where you can go. Okay, thank you. And then the final question, when you were a student, how was your library the most helpful, and what do you wish they could have done for you?
When I was a student, oh goodness. Okay, now I really have to try to I have to really try to remember way back when I was a student. Yeah, when I was a student, my library, I physically went to my library. I know a lot of students now use online libraries, so I think I would be much better off with all the online databases and references. With me working for University of North Texas, they have a great online library. So, I don't know. That's a hard one for me to answer. guess I have to think about that a little bit more. I'm sorry.
Well, that's okay. We're always trying to figure out the best way to help our students and our users at our libraries.
Thanks for watching. This video was produced by the network of the National Library of Medicine. Select the circular channel icon to subscribe to our channel, or select a video thumbnail to watch another video from the channel.